So my name's Colleen, and the purpose of the video this afternoon is to supplement your learning. These are my students. So it's to supplement your learning, not to be comprehensive or to replace your lectures or your readings. So our patient, we're gonna, first of all, we'd come in and make sure we washed our hands and gathered all our equipment, and we'll come in and introduce ourselves to our patient. So patient, I'm gonna have you tell us your name.
Talon Valancourt.
Okay, and then we would check her name band here and birthday.
August 24th, 1997.
Perfect, so we would always double check her name against what she's saying and her ID band. So today we're gonna do an abdominal assessment. So with that being said, we wanna make sure that our body positioning is adequate for our backs so we don't injure ourselves. So with that, I'm gonna go ahead and raise the bed up a little bit.
It's a roller coaster.
Hang on, Talon. Yeah. And like I said, we would have already washed our hands and done all those pre-assessment or pre-skill set before we came in. Okay, so with an abdominal assessment, you always want to check the kidneys. So I'm going to do that first. Don't fall off the bed. So I'm just going to come around, and like I said, I already washed my hands. So we're just gonna come down here, feel the kidney. Sorry, my hands are cold. Try to warm up your hands and warn your patients you're gonna touch them. Any pain back here?
Nope.
So the kidneys are located over here in the flank regions. Okay, all right, you're good?
Yep.
Okay, so with that, I want you to come jump up here. So in the abdominal assessment, you want the patient supine or flat on their back. And we wanna make sure we protect their privacy. So Talon has graciously come in shorts and a sports bra. But if they had a patient gown on, you would want to drape them up to about here and pull the gown up to, so you can see the abdomen. So to start with, we're just going to watch her contour of her rhythm of her breathing. You want to watch for asymmetry, make sure everything is even there. You can see her normal breath. Yeah, no different changes in color other than her birthmark here and here. And I'll try not to tickle you. Okay. So any pain at all, Talon? Okay. So then with that, we start with auscultation first. So you're going to take your stethoscope, and the abdomen has 4 different quadrants. So you're going to start with the right lower quadrant, right upper quadrant, or in this case it'd be left. And then, nope, I'm sorry. Yeah, I'm on the opposite side. So
right and left.
Yep. So you're just going to alternate. So you'd go right, left, right, left. Okay, so we'll just go ahead and listen. So we'll start with the left lower quadrant, and while you're listening, you're going to listen for any abnormal bowel sounds. Then you'd come up here, then over here, and down. So normal bowel sounds should sound like a swoosh, 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 and a normal person's bowel sounds, you're going to hear about 30 of those in about a minute in each quadrant. Okay, so after that, we're going to start with palpating. Okay, so we start with light palpation in every quadrant. And again, my hands are cold, so I'm sorry. Okay. So again, warn your patient that you're going to touch them before you touch them. Okay, so here we go. Okay, we're going to start in the lower quadrant. Just one hand is light palpation. Doing okay?
Mm-hmm.
Down here. Okay. Any pain or anything? Okay, everything felt good here. So then you're gonna come again, and then you're gonna do a deeper palpation. I'm right-handed, so you're gonna take your right hand down, or whichever your dominant hand is, and then you're gonna just push a little harder, and you're just gonna feel. You wanna feel for any masses, and you just alternate all the quadrants here. It's okay to push hard. And the patient will tell you if you're pushing too hard. Okay? You okay?
Yeah.
Any pain?
No.
Okay. So that's palpation. If you feel anything abnormal, it's okay to push a little harder. If the patient flinches or quivers or anything, then you know something is wrong. Appendix is in the right lower quadrant. Liver's up here in the left upper quadrant. Spleen's in the left, and then the spleen's over here in the left, like mid upper to mid quadrant. So with that said, we're gonna come all back and we're gonna try to access the liver here. So what I do is I come along like this with my hand, so you can see where her ribs are right here. So I'm gonna put my thumb right underneath here, okay? And I'm gonna take my other hand and just kind of feel right up in there. And you should feel the edge of that liver or the wall. And I can feel the top there. Is that hurting?
No, it's just
Can you feel that?
Yeah.
Yeah, most people can feel that when you're palpating their liver, so it's kind of different, huh? Okay.
Yeah.
Take a big breath. Hold. Sometimes that's another little trick. So if you have them hold their breath, you can feel it right there. Okay, breathe out. And then can you feel that moving?
Yeah.
Yeah. Okay, so that's where the liver is located. Then the spleen is just, we should not be able to feel the spleen. That's normal. If we're feeling the spleen, then we have a problem. So it's kind of in the same location, just on the other side. So I again come right over here, try to make that like an L almost with my hand, and then I come with the other hand and just feel in here. Feel anything there?
I don't think so.
Nope, nope, and I'm not feeling anything in there either, which is normal, okay?
And normal.
Are you okay?
Yeah.
Okay. And then I also forgot to mention, with the abdominal assessment, we're gonna try to find the aorta here. So, which is just a little above the umbilicus. So it's like right in here. Should be able to feel that. Okay, got it? And then we can listen with the bell of our stethoscope for the aortic sounds. And a lot of people refer to that as like the big red, and you'll hear a different beat. There it is. That's more of a swooshing sound. So, yeah. The other thing I forgot to mention when you're listening to bowel sounds, it's okay. Actually, I would recommend that you oscillate with the bell and the diaphragm of your stethoscope just to hear the different sounds. Okay. Any questions?
I don't think so.
Okay, that's an abdominal assessment. Thank you.